Hello, hello, hello. Happy Tuesday. Happy Tuesday, my ATHLers. I hope my volume is up. Let me just check there. Oh, today's Tuesday. I hesitated on coming on tonight because I decided to do this topic um, earlier, and I was on my way home is when I heard everything that's going on. So first start off with, my name is Abby Tyler. I am a family nurse practitioner. I'm your host, content creator, and a community health volunteer. Today we're going to be talking about how to help your child safely transition from pediatric care to adult health care. But in the midst of everything that has gone on over today, the past day, and the tragedies going on, that's happened in Texas. So far, I think there's 15 kids have died, and the grandmother of the shooter. So, in that, with respect to the family members and everything, I would just like to take a moment of silence for the teachers, the teaching community, parents, and everybody. So, please join me and just use a minute of silence in respect for those who have passed away. Okay, alrighty. So, as we all know, the tragedy that's happened in Texas is just seems like it's been repeating forever. I remember the first time, the one that I remember from way back then was Columbine, and my daughter was about 3 years at the time. And I said, "Give me, our children gonna have to be going through this every year." Yeah, and since then it's been dozens and dozens, and it's the same thing over and over. I'm not here to talk about politics. Gun violence is a public health issue, especially where children are involved. It's a public health issue. These kids witness these horrible acts. Remember when I talked about adverse childhood experiences, you experiencing all these horrible acts before even age 18, and you see it whether you experience it firsthand or you see it on the news over and over. It's like it changes your whole mentality as you grow up. And there's some of these kids don't have access to mental health care. The parents cannot afford to take them to therapy to do everything. And sometimes they bring the therapy dogs to the school. They provide counselors to school for a couple of weeks for the children to get through it. But that lives with them. I know when way back then, 1996, when I, like I said, going back to Columbine, when I first, and that scared me. Then when Sandy Hook happened, and it's like we talk about, thoughts and prayers, and it's the same thing over and over and over and over again. There are people who are holding and their kids tonight. There are people who are supposed to be getting ready for the end of the school year, planning vacations to go. And instead, they're planning on what outfit the child's going to wear in the casket. They're, I mean, it just doesn't make any sense anymore. And sadly, it was last week. It was the last week or the week before that when that tragedy happened in Buffalo when this girl got killed. And sadly, I said, I bet you there's somebody who's sitting somewhere and thinking about doing something now so they can be just as famous and just to do this. And it always seems to happen that way. So I'm not going to talk about the politics part and the kids. The pain is still raw right now. So for the parents, teachers, everybody who's going through everything right now, our thoughts and prayers are with you because right now that's all we can do. Our thoughts and prayers are with you. For those of you who, like me, or any parent right now or guardian, hold your children a little tighter. Hold them tight. If you're home when they're going to school in the morning and you say, bye, mom, bye, dad, or bye, grandma, bye, wherever role you play in their lives right now, you know, just look at their faces before they leave the house in the morning. Look at their faces and say, I know some people don't say I love you and all that, depending on your culture, depending on the way you're raised. You don't say I love you, but even if it means to hug your child, let them think that you're being corny. Let them think that, oh my God, mom, everything's fine. But you never know. You just never know if that would be the last time you're going to see them. They don't know the last time they're going to see you too, because even going anywhere in public place is not safe. People say, okay, we don't talk about gun violence until it happens in a mass scale. Yes, we do talk about gun violence and everywhere. We talk about crime of proximity, meaning because some people say this color and this color is crime of proximity. Wherever it is you live, chances are more than likely that's the person that you're going to be harming. So please, for those of you who, want to go out there and whatever the gun issue is, whatever your issues are tonight, just hug your kids a little bit closer, because it just seems like these kids are going to be going there forever. And if they don't get the care that they need after all that, imagine going through life knowing that you sat there and you saw your classmate get killed or get harmed, or your family member and brothers and sisters. Imagine your siblings of the same school, you know? Like, okay, you hear that, okay, the evacuating the school, and you realize it's your sibling that was in that class, or your cousin that was in that class, or a neighbor that was in that class. It's just, it's so heartbreaking. It's so heartbreaking. And I didn't want to come on and talk about this now, but I didn't want to just go on this topic without first talking about it. When will it stop? What do we have to do to make it stop? I just hold your kids a little closer tonight. When they come home, give them a hug, rub their back, rub their head, do whatever. Like I said, if they say you're corny, go ahead, let them be corny, because you just never know. And it shouldn't take a tragedy to make you love on them a little bit more, regardless of all the things that they do. But unfortunately, we live in a real life setting, and some of these things make you realize that time is so precious, and it's not guaranteed, because those kids are supposed to be getting ready for summer, having their water ice, playing the pool, hanging around with family members. We just went through a pandemic, seeing something different, and right away everything stopped. Everything stopped. I'm not even going to talk about the shooter, because I'm not giving anybody any fame. When will it stop? When will it stop? It's a public health issue. So it's not in public health, politics, healthcare, everything. But gun violence is a public health issue. And I talked about adverse childhood experiences, and this is one of the things I'm talking about. When you experience something that completely remodel your DNA and all that, your thinking, your psyche, and all that. So please pray for the family members tonight that are going through this. Pray for all those who have gone through this. Pray for them to, the government, at least, if they can, if they're not going to do anything about all this, at least be able to provide, therapy for a long time, because they're going to need it for a long time. They're going to need it for a long time, because I can guarantee you children who survived Columbine are still going through it today. Okay. And so talking about, I want to talk about transitioning from pediatrics to adult healthcare. Alrighty. I didn't want to go through this, but I'm just trying to get this out of the way, because like I said, I just found out about this like an hour ago when I'm on my way home at 5:00, 5:15. I was like, okay, let me just put this on while I'm driving out of the parking lot, and that's when I heard it. Alrighty, so for those of you who I'm going to be talking about transitioning from pediatrics to adult healthcare, so let me just go on there and look at my notes here. 1 second. I'm going to just share this. So just give me 2 seconds. Let me just share this video, because I didn't even put it on my other site. So, silence and respect. Okay, so I'm going to do this and share to a group. Share. Okay. Okay. Back, get on there. And okay, so for those of you who have children who are, pediatricians. I'm not a pediatric nurse practitioner, like I said that, but I am trained to take care of pediatric patients. For those of you who have children, up until pediatrics see the patients until about 18. Some would see them 18. Some would stop seeing them at at 18. Some would see them up until like they're a bit about 25, 26 when they get off. I remember my children's pediatrician said, "I'll see you until you start having your children." So, but at age 26. So, but by then the kids don't want to go to the pediatricians anyway. My son didn't want to go, mainly when he was like maybe 14, 15, because he said, I don't want to be sitting there in the waiting room, and I got this babies over here crying and a little kids crying, and he was sitting in their little chairs and his legs were so long. He's like, I don't want to be here anymore, mommy. I want to be. And I said, no, you have to stay with your pediatrician until you get to a certain age. But usually, so starting from let me go from the beginning there and go on. Okay. So the American Academy of Pediatrics recommend that you start thinking about it, you start talking about transitioning at age like maybe 13 to 14. That's when you start having a conversation, because again, that's when most kids start saying, I don't want to go to see a pediatrician. By then they already passed the way over the puberty area now, so they're getting to young adulthood, late teenage years, young adulthood. They begin to understand things differently, and they're getting more experiences, and they're also getting more freedom and independent and more understanding of their bodies. And also at this point, that's when they say start talking about it. Don't wait until they're about 18 and then say, okay, it's time to go, or when you absolutely have to go. So start having that conversation with them right now. Again, my disclaimer, everything I say here, please don't make any changes without speaking to your provider, your doctor, or everybody first, okay? So, as parents, we go through all these different transitions from kindergarten to elementary to high school to college. But choosing a pediatrician is also one of the most important decisions you can make in your child's life, because that child will be with that pediatrician much longer, because the chances are more than likely they will be changing their adult doctor maybe once or twice during their lifetime. But for your pediatrician, they're there. They see them go through everything, lose the tooth, go through puberty, everything. They have a strong relationship. So most kids kind of bond with their pediatrician. So now when you're telling them they have to change from that pediatrician because this is who they know, it can be a little traumatic for some kids. And also it can be like for a while they're trying to get a new doctor, establish care, and do all that. That can be a little bit tricky for parents and just the harder part. So I thought about that. Mainly, I'm on the other end where I see patients that come from pediatrics. So this time around is I'm talking about people making a transition. So when they come to me, they're not lost out in the world and don't know what's going on. Okay, so I'll go in there. So, like I did say, the American Academy of Pediatrics recommend at age 12 start talking about it. The doctors and parents can assist the youth and young adults to manage their own health care. Okay, so these skills includes making appointments. Start teaching them how to make an appointment. If they can get on the phone, you can sit right next to them. I do that with my son; he's older now. Start teaching them and say, okay, I'm going to make an appointment. Call, and you can have your insurance card. Make sure you have your insurance card next to you. Call and make the appointment. Tell them what you come in for. Try to see what days you're available. If they're in school, of course, it's going to be you doing it and all that. But usually when they're like 15, 16, they have their sports and everything going on. So at least that way they can start explaining, okay, I can't go this time because I have this sport, or I have this game, or I have this play. You can start doing that. Like, again, like I said, they have it getting a little autonomy, and they can make decisions, you know, along with you, not totally independent, but with you, because at that time they still consider a minor. Also, by the time they're like 13, 14, 15, they're meeting with a pediatrician alone anyways. You're usually sitting in the waiting room, and they're meeting with a pediatrician, unless if it's something where the pediatrician has to see their bodies, then you can be in there, and also the nurse or the medical assistant, depending on the office setting. All right, so start making times of your appointment. Start teaching them how do you go to the store to get your prescriptions filled. When you go, you go to the drugstore. My name is this. This is my birth date, and it'll tell you, do you have any questions? Usually, the pharmacist will ask you any question. Do you have any questions? Tell them make sure they're speaking to the doctor and saying, what is this medication for? What should I look out for when I take this medication? Can I play my sports on this medication? Can I go play? Can I go to school trip on this different medication? So when they start asking this question and asking the doctor and also the pharmacist directly, they're gaining, like I said, they're gaining independence and understanding, because they got to be doing this when they get into adult world. I saw a TikTok video and another video with this comedian where she was talking. She said, Ma, the doctor told me to do this. Am I supposed to do this? No, they told me to take this on the medication about it. When am I supposed to do this? So that's funny, but also when they get to that point, they start asking those questions. So it's best to start telling them ahead of time. And of course, you can still be there after they become an adult, but you still want to at least start practicing that. Okay, filling out this prescription, knowing your family history, start knowing the family history. Like, that's if you had your mother the child is maybe child 15, 16, when the mother developed breast cancer, God forbid, or any kind of gynecological cancer or like that, as the child getting older, because usually you say, I don't want to bother my child. I don't want to, I don't want to tell them exactly what's going on. That female child, even the male child, because he's carrying that gene also. They want to tell them, okay, yes, my mom had this cancer, my grandmother had this cancer, my mother had this, or my father had this. They need to start knowing that, and you want to start writing these things down too, because they're going to need to know that when they go into the adult healthcare. And also because if even if it's in their records at the pediatrician office, they need to start knowing that now. So it's best to start compiling all those things when you start making like a little booklet and start getting the medical records and start teaching them that, so they'll know when they come to me, they can answer those questions. And just, I always tell patients, like family members, if you come in the first time coming to the adult doctor, you want to make sure you come with your child, so at least that way you can be there to give more information, because sometimes they may forget it, it's not written down, and they won't know how to answer all those different questions. Sometimes the questions can be a little bit intricate, and they need to be able to understand that. So it's always, they feel more comfortable when the family members around that's been there all this time for them. All right. Of course, we're going to ask their permission first, because that's one of the things to wear privacy. When it gets to a certain age, you can just walk in with them. We have to ask them for permission. Even if they're still on your insurance, we have to ask their permission. Okay. So you want to also do that, start doing skills, like I said, manage your own healthcare, making decisions, making a amendment. You want to talk to the doctor and say, can I have a summary of everything that's been going on, especially the ones who have chronic diseases. They're like diabetes or ADHD or anything that they see another pediatric specialist for. You want to call that pediatric specialist and say, okay, they're going to be moving on into the adult world. Of course, they don't know that, and some specialists don't see anybody past 18. So you want to get that information from them as well, and start when you find a family doctor that you're going to go to. Usually, it's going to probably be your doctor, but you may not, when you're trying to go to your doctor, you may want to find a totally different doctor for them. So get all that information, because now leaving from that person. So like at the end, let's say they're saying, okay, I'm going to be changing doctors when I turn 19. All right. But you also see the endocrinologist for your diabetes, or you see the psychiatrist or the therapist for mental health care. If they don't see anybody after age 18, if they do prescribe any medications for them, you want to make sure that they get the Can you please continue to, can you ask them, will you be able to continue prescribing medication for me until I find my other doctor? Because again, like I said last time, it's very hard to find a mental health provider very easily. So you don't want them just going out without that medication. You don't want to just stop it. So usually if it's already started, the PCP can continue until they find a therapist again. But for those things that want to continue the therapy, they want to continue seeing a psychiatrist if they're supposed to, and continue. So you want to make a transfer as smoothly as possible. Okay, as smooth as possible. Sorry, as smoothly as possible. Alrighty, so we go in there, the planning, you're just discussing in privacy. Okay, one issue, privacy. Like again, like I said, there would be times where you say, well, wait a second, this insurance is in my name, but you cannot make any decisions. They can't tell you any test results, none of those things. Even sometimes when I call for my son and I know the privacy issue and all that, I will call in to make an appointment. They'll say, is your son there? And your son, your son's daughter there. They'll have to give permission in order for you to even make an appointment for them or even ask any questions. So privacy issue for those of us who come from different cultures, who think, oh my God, what are you talking about? My own, the person living in my house and I can say anything. No, you know that at age 18. And sometimes depending on the state that you're in, also at age 16, you're not, you can read anything. Even for like you go to the library, you can even look to see what library books they get out of the library. And like, you still live in my house, but privacy issues and all that, it varies with different state. So you want to check with your PCP, and you also want to check with your child's pediatrician what it is that you won't have any access to without asking their permission. All right. Again, some things the children they won't tell you. Alrighty. So the goal is to make it that start understanding the health condition. I told you medication, especially the medication. Let them know what medication they're taking. They can have it written down. All these kids have secret apps now, so they can have it in secret apps and put it there so that anybody can just look in their phone and see it. Also, if your child is doing anything with birth control, or sometimes girls, they're taking the birth control mainly for menstrual irregularities. Some of them have really heavy periods, and again, like I said, there's no reason why a child should be bleeding so heavily and in so much pain that will cause them to stay home from school and everything because of that. They have so many methods of contraception and methods out there, different options that can help them so they're not missing school because every month. because some children have, some women have problems with the menstrual cycle. They have severe back pain, they have severe headaches, some have nausea and vomiting, and all. You don't want a child missing school every month. So talk to your GYN, and also again, like I said, you'll be going to different specialists. Make sure you have all those names of specialists down, and make sure you have their medical records ready to be transferred. Okay, speak name. Also, like I said, let the child speak directly to the doctor. I'm not going to make this too long. Okay, let the child speak directly to the doctor. Start giving them more. If those who can drive, if they're get like maybe 16, 17, start having them drive themselves to the doctor's office. All right, and then you can also, okay, what did the doctor say today? Remember, now if there's any issue with if any suicidal ideations or anything, that doctor is on the obligation to tell you, and that child would know that too. That yes, we have to tell your parents, because you talk about anything suicidal or homicidal, they have to let them know. And so you tell your child that we can ask that question. Okay, so also, like I said, demonstrate different abilities. They can go to different. There are different specialists. Be able to talk to them. Knowing the most important thing is like knowing your medications, knowing when you're supposed to take your medication, and also tell them, especially if it's chronic disease, there will come a time where you're not going to be telling them, did you take your medicine? Did you take your medicine yet? Did you take your medicine? Start telling them you're going to start taking medicine. You're going to be watching the bottle and making sure that, okay, if you're supposed to be taking 30 pills, and 29 days into it and you still have all these many pills, are you taking your medicine? Explain to them that this medication you're taking are to keep you safe, especially for those who have chronic diseases like diabetes, like ADHD, like all those different things, any kind of autoimmune disease. These are medications to keep you safe. And especially things where, like I said, if they have to see a therapist, making sure they're seeing the therapist. If they go into for other reasons, medical reasons like Crohn's disease and other things, and that have to keep up with it, they can't just stop. Even though some diseases may have no symptoms, doesn't mean that it's not causing damage to your body if you're not following up with it. All right. And one more thing here. So you can be also, like I said, meet privately with the doctor, discuss that issue. Uh and then, okay, so parents, you play a key role. Like I said, some of the questions you can ask your doctor, when does my child start to meet with you alone for part of the visit to become more independent in the healthcare? Like I said, some doctors usually starting around like 13, 14. That's when the parents don't are allowed in the room. You would allow in the room, but most of the times the doctor will always speak to the parent, to the child by themselves before then they can say you can come into the room, because there are times where we have to speak to the child alone. You want to be able to sit there and talk to the child and make sure if you ask them questions about abuse or anything else, the parents cannot be there, because what if the parents is the one that's abusing the child? So we need to know that, and just to make the child a little bit more independent too, because it's all about growth and development. All right. When does my child need to get ready for adult health care? Again, like I said, you ask those questions. Those are questions that the parents can be asking the pediatrician. Do you have any checklists or self-care skills that my child needs to learn? So they can, doctors will say, oh yeah, we have this here. You can take this home and you both can and review on it. Can I work with you to prepare medical summary and emergency care for my child? So get all that, because the beginning of the school year over here where you have to fill out 10,000 paper for emergency care. At they get to a certain point, that's you, they're going to be calling for emergency. But like I said, also if they might say no, getting somebody else, even though the child's on your insurance, still you still need to ask permission for that. Alrighty, so you want to say, okay, do I need to wait till my child turns 18? Or some parents, some parents do. Like I said, I felt better for my son to stay with the pediatrician until he was 18. Okay, I'm in the health field, so I knew everything else. So that not knew everything else, but I didn't want him transitioning yet. But so as soon as he turned 18, he couldn't wait to hurry up and go to an adult doctor. Alright, can I get some information about this? And do you know any doctors, any adult doctors who my child to transfer to? Like, again, like I said, most people would just take their children to their doctor, the family doctor that they're seeing. If they have a good relationship with that doctor, they would just say, okay, I would just bring everything to this doctor. And again, when they come to see me, please make sure that they're, you come in with them at least for the first of the visit, or you can be on the phone, because there will be things I'm going to be asking that they may not have that information right. And now when you go to the doctor's office, there's so many things that you have to fill out before even going in, because you're doing your PHQ-9, you're doing the GAT-7, you're doing all these different forms that are quality measures that we have to meet for per government guidelines. So they may not know all that. And like I said, medical history, sometimes I ask them, I say, anybody in your family had this? If they come in, sometimes even they come in with a complaint, Anybody had this. I don't know. My mom had this, and I know sometimes our culture, we like to keep everything inside. We like, oh, I don't want to tell this person this. I don't want to tell this person that. Or I don't want to tell my children this. I don't want to burden them. But at the same time, it's certain things that are secret. Like I said, female issues that I don't want to tell my son. You don't really have to tell your son that. I don't want to tell my daughter, and some people don't think that you should even tell their daughters. So, but if you, as your daughter gets older, whatever is going on, if especially if it's something that is hereditary, you need to tell them. If you had fibroid issue, if you had issues where you had to have surgery to correct certain things, you need to tell them that, because that's part of the medical history. They share your DNA. That's part of medical history. Doesn't necessarily mean that they're going to get it, but it just puts them in a position higher risk of getting whatever it is that's caused that. So you want to make sure you discuss that with them. So when they become an adult, they can have that information. And when they start having symptoms, when they come to us, and we can say, okay, maybe who had this? Was it your mother? Who had this? Was it your father? And think there's prostate cancer and other issues that go on on the male side. So you want to know that. And so the boy's supposed to know if the mother had breast cancer. You don't have to go into detail and all that, because like I said, it can be a detail, and some men can have breast cancer too. But also when he has a daughter, he's passing that gene on. So they have to be aware of that as well. All right. And he just basically follow up with him. And I think I also had and when, like, again, when you come to me, make the appointment and you call in, let me know, I'm not gonna be the one on the phone. You're gonna be talking to the staff. This is my first visit. I'm coming in as a new patient. The last time I saw a doctor, it was my pediatrician. So I'm gonna be, I'm a little nervous. And my mom cannot come with me, or my pop cannot come with me, or my guardian cannot come with me, or they can come with me. They can be on the phone. Is it okay? And so that way we know that, because this patient's first visit with an adult doctor, so we can have extra time to talk to them. Of course, the first visit will be 30 minutes, but at least that way, and we'll be asking questions. So don't be nervous. When you don't have to know everything at the first visit, you can go back home and say, okay, I thought about something, and I know the doctor wants to do this, and they want to do some blood work, and they want me to do that, because we may send you for a test, we may send you for ultrasound, we may send you for chest x-ray. Where do I go from there? Which hospital am I in? Based on my insurance, can I go to this other hospital? No, your insurance is not going to allow you to do that. So you want to be able to know all those things, how to navigate the healthcare setting, new doctors and all. All right. So, and I think I talked about something on my page where I was saying that people go to parties, and then they get the kids, and the kids are running all over. Going back to pediatrics again, the kids do not have the physiological, medical capacity to sit still. So if you take your kids to these parties where you're sitting there, especially when it comes to certain cultures where the party is supposed to start at 6 o'clock, it doesn't start to 9, and you take a little kid, or young, or even like a young adult, young youth, teenage child, and you take them to these parties, and they're sitting there, and they're waiting, and they're waiting, and then people start, and they got these speeches, and they got this. The kids are going to run around. They don't have the mental capacity to sit down, to sit still for hours and hours and hours. Okay. And even they're running around. It's like, okay, some people say they like them running around. They're running around. It's not safe. There have been times I've been at a party where I said, sit down, you have a lollipop in your mouth. And I don't feel like I need to discipline anybody's child, but I can't sit there and watch somebody running around with a lollipop in their mouth, or running around with a fork in their hands, and knowing for what the potential of severe injury. Okay. Your child runs around and they fall with a lollipop, and they could like literally choke themselves to death right there. Okay. So they don't have that. Take their dolls with them, take their games. I used to do that with my son. It's like, take their games with them, take anything that would keep them, and then take them outside every once in a while so they can go ahead and play and let out all that thing. And there's no reason. I understand sometimes you must take your kids to the formal thing because it's for a family event, the grandchildren and the cousins and everything have to be there. But parents, please pay attention to your kids. Please. It's not just that the fact that the children are running over here and they're going that way and they're running on and being unsupervised, going to the bathroom or going outside unsupervised. There are people who are predators at these events. Anything can happen. Anything can happen to your child that can totally change their lives. So just because they're like, oh yeah, I got to bring my child, I got to do this, and you still have to be careful about that. I'm just with my little tantrum right now. Sorry. So it's that serious, because anything happen quickly. It takes like what, you're not paying attention to your child for 10 to 15 minutes. It takes that short of a period first of all an adult to grab that child, and sometimes even grab that child, walk out before you realize they're right across the street, or they're already in the car and they're gone. And then what are you going to say then? So I understand. I'm not talking about babysitting issues. If you don't have babysitting, there's been many times where I was going somewhere, they said no kids, and I said, okay, well, when my kids were younger, okay, then I won't come because I don't have a babysitter tonight. Yeah, and I really wanted to be there, but I don't have a babysitter tonight. but you got to be careful. And also, please don't bring young babies out. I mean, in night air, it's like people coughing and going on. This COVID out there. Do not bring your young infants out to things where you have like 150 people sitting around coughing, touching this and all that. Why? I mean, what is it? Even if you have to come out to see the person who's there, okay. I'm coming to my grandfather or my grandmother's event. You're gonna sacrifice your 2 month old baby for that? And you just, one person stay home or one person come to the event and one person go back home and do that. It's not safe. These are all pediatrics. This is all health issues I'm talking about. It's not just saying what, I'm griping about whatever it is. So social issues, which are public health issues, So I've been on the table before where I sat there and the person was literally, the lady just, I guess she saw me and she thought I was responsible. And she just left me there with her 3 children. And so I just became the de facto babysitter. What if I was some kind of predator? Women can be predators. People doing child trafficking and doing everything. All I had to do was hold their hands and walk out the door. So be careful. It's not about, oh yeah, you want to be this, you want to be that. It's like the public health issue, the health issue behind it. It takes 5 to 10 minutes for somebody just hold your child's hand and walk out the door. It takes about 5 to 10 minutes to take your child into the bathroom and sexually assault them. Okay. Or the child could be running around with something and poke the eye with a fork or lollipop, like I said, and choke themselves to death. So yes, I know you want to be out there, and yes, I know you want to be from. Bring their toys, bring their dolls, bring their games. Let them keep them, and don't be there for too long either, because kids they don't have the ability to just sit there over and over for hours and hours and hours and hours. Okay. So I know I was talking about transitioning and all, but this is all in the realm of pediatrics. So bottom line, to conclude, make sure you want to start doing what it is that you're doing, transitioning your kids at age, start talking about it at age 14 to 15, but as early as 12. Start talking about it. If the kids want to start seeing a pediatrics, an adult doctor, maybe around 13 to 14, because like I said, my son didn't want to continue going because he felt he was too grown to be there. Start talking about it, making sure you're getting all the medical records, and especially for children who have intellectual delay and all that. That's very, very, very important, because when you start moving from that pediatric part to the adult part, that transition can be very hectic. It can be very, very hectic, because there's so many, they rely on so many different services, and then also social services too. So start talking about it very early. You don't want to wait till the age 19 to find out that your child who's got intellectual disability, that they can't get this, they can't get that, because you don't want to just abruptly stop a care. You want to continue. Again, if they go into any specialist that prescribe medication outside of their pediatrician, making sure that, okay, I just want to ask you, if I get to the point where I can find an adult doctor, will you please continue prescribing the medication for me until I can find an adult doctor, especially when it comes to things like psychiatrists and all that, and they prescribe medication. So you want to make sure and then do that. And as quickly as possible, get a good doctor, let your child go there, let them get a feel for it. And you don't have to be with that adult doctor if you get there and your child say, I don't know. I get the feeling that this is not going to work out. Listen to them. And then you can always find another doctor. You two don't necessarily have to have the same family doctor. Let them find their own doctor. Let them get somebody who they're more comfortable with and go on from there. Okay, so that's all I have to say today. Again, I am on YouTube for those family members who don't have friends who are not on Facebook. I'm on YouTube. I'm also on Twitter. And so please, if anything I said here, just please like, comment, and subscribe. Also YouTube as well. And again, please say a prayer for this innocent soul and the family members that are left behind, who will be left to carry on with such, that you can't imagine, unimaginable pain. No parent should ever bury their child. No parent should ever bury their child. So I know I went to a deep depression after Columbine. So sometimes I try not to, and as grown as I am, I try not to internalize that it hurts, because as a parent, you hurt for, these bright little kids who are getting ready for life, and just have their life snuffed out of them. And the parents that have to go through this as well, and brothers and sisters too. People always talk about their parents, but they don't pay attention to the siblings that survive. And that can be very traumatic. It can be very, very traumatic. So please, these government people out there, if before you get this gun issue squared away, please keep more resources in that for mental health care, because and talk to your kids. I know somebody would be too afraid to go to school tomorrow. Somebody that's too afraid to even continue the school year. I don't know if they're going to continue the school year over at the school. They're thinking, okay, I go to school tomorrow. Who's to say? So talk to them, reassure them that you're doing everything to keep them safe. You're doing everything to keep them safe. And also give them extra hug. Give them extra hug tonight. Is left together. If they say they want to go somewhere to the park today and tomorrow, all that, whatever it is that you have planned, and if it's not that important, let's go. Let's go walking. Let's just go walking. Again, go for a walk and then just talk and just let them talk. Okay? Let them talk because they may not know how to express their feelings, but let them talk and just listen and just reassure them you're going to do everything in your power to help. And they might say, well, you're not going to be at my school, but just say you're doing everything otherwise, to keep them safe. Because unfortunately, there's not much more we can do to keep them safe when they're not with us. But you're doing everything. You're going to do everything your best to keep them safe, and that's all you can do. So pray for the family, pray for the country, pray for the world, and just let me see if I have any questions there, any comments. Okay. Jackie Jackson said it's so sad. Yes, it is. Yes, it is. It's just, it just, excuse me there. Once again, we're talking about the same thing 1 week later. And so for all of those who are watching, I know the program I just was going to talk about transitioning, but when something like this happens, especially when it happens to our kids, you can just come on and not talk about it. So I wish you all a safe night. Hug your kids, give them extra hugs. If you're not a parent and you have youngsters in your home or a family member, call them up and be like, hey buddy, how you doing? And just listen to them talk, because sometimes they may not be able to talk to their parents, but they'll be able to talk to you if you're the favorite uncle or favorite aunt or somebody who they just find, hold you close to their heart. Find time to go there and just hang out with them. Okay. And just find, don't make them feel overwhelmed. If they don't want to talk about it, don't bring it up yet, because some kids have their own timing when it comes to emotions. So just understand that. All right. So I wish you all a good night, and God bless and take care. And I'll be back on Friday. Thank you, and thanks for watching. Good night.